Striking National Education, Health and Allied Workers Union members say they are determined now more than ever to make their concerns heard. At a media briefing earlier today, the union vowed to intensify protests from tomorrow until its demands are met. It's accusing the government of being arrogant during negotiations. The union is demanding a 10% wage hike, but the government offered 4.7%. Operations have been disrupted at various health facilities countrywide since the strike began last Monday. The Labour Appeal Court, meanwhile, will decide on Monday on the union's appeal against the interdict by government to try to stop the strike.
To our dismay, the negotiators of employer made the U-turn when we thought that we are registering progress by indicating that they are no longer interested in negotiating a settlement agreement to resolve the impasse. The employer arrogantly demanded that we must drop the dispute process and return to the council to engage on the 2023-2024 public service wage negotiations. Again, this is another demonstration of how far government is prepared to undermine and collapse collective bargaining and the dispute resolution mechanism by imposing their will on workers. We are aware that certain ministers inside the mandating committee of the employer have refused to support the new minister, Umamonotolo Kivit, to resolve the impasse. Instead, they engage in tactics to divide unions, and we want to warn them that this approach is regressive and will collapse public service. At the onset of the facilitation process, we were upfront in trying to resolve the dispute by tabling a proposed settlement agreement which entails, among others, cessation of hostilities, which was meant to see parties agreeing on resolving the strike and talking to relevant issues linked to hostilities. 2, defending the council and collective bargaining, which meant that the parties will agree on defending the SABC and as such the unions that are currently not part of the 2023-2024 round of collective bargaining to return to the council and participate fully. 3, augmentation of the 2020 salary increase, which meant that the state having unilaterally implemented 3% salary increase for 2020-2023 financial year will augment at least 3% with a percentage to be agreed by parties. For minimum service level agreement, that parties agrees that the long outstanding issue of the minimum service level agreement be concluded in council within the period of 6 months. As Nehawu, we want to register that it's becoming quite clear to us that despite all our efforts to resolve the dispute, the government is not interested in concluding the 2022-2023 dispute, as they argue that they have closed and concluded the negotiations in that financial year. This was despite the fact that there was no resolution for that financial year, but rather a unilateral implementation of the 3%, which was way below the CPI. With this arrogance displayed by government, it is important to confirm that Nehawu continues with the strike in a more intensified manner as from tomorrow, Monday, the 13th March 2023, to demonstrate to government the seriousness with which we take the concerted efforts to underplay the role and the significance of public servants who are at the coalface of service delivery.
The Critical Care Society of Southern Africa has added its voice and condemnation to the strike action. The organization says that the protests have severely impacted the lives of patients in intensive care unit. Let's discuss this further then. We're joined via Zoom by Professor Fatima Paruk, the Critical Care Society of Southern Africa's president. A very good afternoon to you, Prof. Thank you for joining us.
Good afternoon to you, Flo, as well.
Talk to us about the impact of the strike on the lives of patients in intensive care unit and your condemnation of this particular strike action.
Flo, it's very difficult to quantify at this stage the true impact of this strike. we are at a crisis point, and usually during a crisis, it's only after it's well resolved that the true impact really emerges. Currently, what we're relying largely is on the reports that are emerging from the media. And what we can really see is that around the country, there are problems at our healthcare facilities in terms of access to healthcare, in terms of healthcare workers not being able to perform their duties, and we're also seeing reports of associations with loss of life. And what is very worrying for us is that if you look at critical care, under normal circumstances, we are always under pressure. We have a shortage of ICU beds. We have a shortage of ICU nurses. It's a highly skill-dependent profession relying on ICU-trained specialists, ICU-trained nurses, practitioners like dietitians, physiotherapists. It's a huge team. And now if you add on already constrained, pressurized environment disruptions, take away resources like nurses, and have added burden of a greater number of ICU admissions, the system just will not hold. We just don't have the reserve. So it's actually quite a catastrophe. And hearing that the strike is going to intensify is very concerning to the society.
Yeah. Prof, I mean, we can hear condemnations, whether it's from you or other sectors or from government. But, at the end of the day, when I've spoken to the unions, one of the unions I spoke to in the last hour, at the end of the day, they want, their grievances to be heard. So we can say we're condemning what you're doing, but what are we saying they should do instead in terms of expressing their unhappiness? What should be in place of this? Because I would assume that they believe that this is, the final straw in terms of how to express their anger or unhappiness with their situation and their pay in this particular instance.
So what is very clear is that the current strike action is causing major harm. And the reality is it needs to go on pause. We need to stop that strike action. What we need to do is the necessary organizations and structures need to regroup, re-engage, and find a solution in a manner that's more constructive and that's not going to cause immense harm to the public servants. Because right now, we are facing an immense crisis.
Yeah. And what are some of the measures at the moment? I mean, you're really painting a sort of bleak picture, so I wonder if this question is even relevant. But, do you have measures in place in order to, mitigate against the impact of the strike on intensive care unit? And as you rightly say, and this has been discussed, the strike is set to intensify. And in fact, we're hearing of other unions joining in on the strike. And this will obviously then mean these are unions that are linked to each other. And then the whole system, I imagine a domino effect really of what's to take place. But do you have anything in place as contingency measures?
So, Flo, when you have a well-resourced system, you can have mechanisms in place,
Yeah.
But when you have a system that already doesn't have any reserve, add to that disruptions, add to that further erosion of its resources, the system doesn't hold. There's no room for mitigation. The only solution, and there's only one effective solution, and that is to stop striking and to find another method to achieve a resolution of this dispute.
Yeah. Well, in a statement, you have said the Critical Care Society of Southern Africa has said that the current strike action amounts to severe abuse of human rights of patients by those who are meant to be custodians of their welfare while they are ill. Let's talk about this then. I mean, as I say, we've spoken to some of the unions, and yes, correctly, that is true that they are essential workers, and in fact, the president himself has put that across. And when I put this across to one of the union leaders, I said, yes, you can call us essential workers. You can say that we're the custodians of the welfare of those who are ill, but then give us, the salaries and the remuneration that fits and matches this essential workers, this tag that you give us. How would you respond, to that?
So the dignity and the rights of the citizens of South Africa Africa to healthcare services is non-negotiable. I think that's a framework we start with. And when we find strategies to address disputes, that framework needs to be respected. And really, we need to find a solution within those constructs, because we really cannot be affording our patients indignity or lack of access to healthcare. It's a fundamental right.
All right. Prof, many thanks to you. Professor Fatima Farooq, the Critical Care Society of Southern Africa.